commanders should be able to make the right decision, the best decision for you and your family when it comes to being reimbursed for stays like Airbnb.
Okay, Chief, looks like I got the next one here from Michael Hood from Facebook. He says he wants to know if the Air Force would allow approved retirements to extend so people can properly transition. He says many are departing now and in the next months and forced to cancel ceremonies and are unable to contact vital VA medical and transition appointments, not to mention utilizing terminal leave to safely, effectively job and house hunt. So, right now the stop movement that has been put in place actually exempts, Mike, voluntary separations or retirement. So those who want to continue for retirement or separation can. You're going to see the A1 pushing out to the force through the command teams, the opportunity for those who would like to extend and not retire on their current dates to pull that paperwork and to work a later retirement following the recovery from the COVID. There's a bunch of predictive models out there. I've been studying those. I actually just talked to the Director of Staff as well. I'll just tell you what I'm operating under right now, and it gets refined every day. Initially, it looks like that April and May are going to continue to be very tough. I think we're about to have a couple of our toughest weeks here in the country. It looks like so that takes it through April and May. Then June seems to be about where we're going to level, and then July and August look to be potentially recovery months. Now that's crystal ball. I could be totally off, but that's what we're sort of planning through right now. So there is going to be an opportunity for those who want to extend their retirements and extend their separations to do so, and the A1 will be putting out guidance on that.
All right. Our next question comes from Melissa Michaels, and she would like to know, is that right? Yeah, okay. To what point will we continue accepting students for training coming from high-risk COVID-19 areas without quarantining them before training? We are accepting students from these areas on a daily basis with only conducting enhanced monitoring of temperatures and exposing multiple squadrons, contractors, and our maintainers. These students are given one-time use masks and commonly do not adhere to 6 feet between students. So generally, Michelle, we've cut out all but what we would consider essential training. One of those is, of course, our BMT. Even though we've made some adjustments in the flow of airmen folks that we're bringing in through basic military training, in order to maintain our readiness, we need to continue with the training pipeline. And what we've done with BMT is at the trainees' arrival at BMT, we put them in a 14-day restriction of movement, essentially a quarantine, and monitor and make sure that none of those airmen are sick. To date, we've only had about five to date BMT airmen out of 6,000 to test positive. And most of those were in one of the restricted movement categories. I think we had one that was outside of that. But so we've done, I think, a really good job of quarantining, restricting the movement, testing, and making sure that the folks who enter into the training pipelines that we consider essential and necessary, commanders out in the field. And I applaud our BMT teammates for taking the appropriate actions and doing that work.
Okay, Chief, I got one here from Catherine Ash, but before then I wanted to do a shout out to Air Force Research Labs, AFRL. I know is on the line. Thanks a lot for everything you're doing. I mean, just some incredible work that you're doing to help us not only with this crisis, but also with the technology and getting things from the lab bench to the launch pad. Nobody does it better. Hey, Chief, by the way, I was looking around your office, man. There's some great pictures of you with lots of hair. that's some like seriously great photos on the wall here. Okay.
A long time ago.
Yeah. So Catherine Ash is asking if the moratorium on PCS is going to be extended. My husband is unaccompanied in Korea and was due to come home this summer. And then also from Kathy Cipolla was saying, hey, that's what I was asked too. We're due to PCS at the end of June, so before I put a deposit on a rental home or a new location and find a job, it'd be nice to know the status of those who are due to return or PCS. So timely question, Catherine and Kathy. We just had a discussion this morning, not more than an hour ago, with the Secretary of Defense and all the senior leadership of the department. And this is one of the issues that I brought up, was that the current stop movement plan ends on May 11th. And so the question everybody's asking is what happens on May 12th? And so what the Secretary tasked the Undersecretary for Personnel and Readiness to look at was, does he extend that period of time, or does he turn that over to the services for determinations on what happens May 12th? If you go back to the curve that I just described, that most of us are operating under, May 12th, we're actually not that much better than what we're sitting here today. So just crystal ball only, my sense is that we're probably going to see an extension of the stop movement for some period of time. Part of the discussion we're looking at is kids in school, because schools normally start late August, September. If families are going to move, we want to get families in place before school starts. So, right now, one of the things we're looking at is possibly, if we went for 60 days, 60 days will take you from May till July. Is that get families in place based on what we think the curve is going to look like? So, sorry, I don't have definitive decision for you, but I will tell you that it was discussed today, and I believe the SecDef is looking to make a decision on that either this week or next.
All right. Before the next question, I'd like to give a shout out to the First Sergeant Council at the Wolfpack at Kunsan. Thank you guys for joining, and thanks for taking care of all of our airmen, especially under these circumstances. Our next question comes from Joshua Clifford, and Joshua is asking, will there be any relief offered to civilian employees who PCS'd on orders and had dependents get trapped at the old, in parentheses, high cost, non-foreign Oconus permanent duty station? And he offers the opportunity to elaborate. I think we've had some of our teammates working with Joshua already, but just to answer the question for you, Joshua, as well as other active duty and civilian employees who may be in the same situation. There's a provision for an exception to policy for folks, even though the DoD stop movement has affected all of our PCSs, you can request an exception to policy through your chain of command. And if your commander, the folks in your chain of command have any issues or concerns or challenges, they can contact our Air Force Personnel Center and they can help them work through that process. So hopefully we can get you back with your family soon, Josh, and anybody else who's out there in that situation. So.
Thanks, Chief. Hey, one shout out to Air Mobility Command at Air Force Base, folks working the TACC. I'll tell you what, as we look at the back end of this, between our medical professionals who are racing the sound of the guns and our mobility professionals who are doing the same thing. I mean, my prediction is you'll be the MVPs of this entire response. So thanks to AMC and Global Mobility. We do remain a global nation based on our global mobility. So thanks for that. Got one in from Brian on Facebook. He says, how are you staying fit and resilient? What do you recommend to us? One of the things I think is a great opportunity here is, we're all adjusting our schedules somewhat. And there's an opportunity to actually come out of this, even more physically fit than we went into it. And so I know for me personally, I'm a Peloton rider. Chief Wright's also a Peloton rider. We actually ride against each other from time to time. And so I get in the morning, and that's the first thing I do is hit the Peloton, get a good ride in, and then a good workout. And what I'm finding is that this scheduled new battle rhythm is actually offering a little bit more time for PT. I would just offer to you that there's a number of reasons why we want to make sure we don't lose that focus. Number one, to be resilient against the virus, you want to be physically fit. And so now's the time to really double down on a good fitness program. And the other thing, of course, is it also helps you so much mentally and psychologically to be physically fit. So I would just offer, set some goals for yourself over the period of this time, or how you want to emerge from the back end. And we all, none of us can hit the gym, but there are so many programs online. If you haven't tried it, somebody suggested it to me, and now I'm doing it. There's this program called a 7-minute workout. It's actually a free app. You can go on and get it. And they've got this. It's a full body workout. You can do 1 circuit, 2, 3 circuits. I mean, I'm doing that in addition to riding, and finding that it is really helpful to bust up the workouts a little bit, since we don't have access to the gym. But Brian, look forward to seeing you in the gym when this is all over, and maybe go and work out together. Thanks.
Hey, I just want to reiterate something that you mentioned, boss, our medics, and the incredible work that they've been doing. And I think I can agree with you that between them and our mobility airmen, they will be the MVPs of this when it's all said and done. So I want to thank all the medics out there. I'm a medic at heart, and I appreciate the tough things that you guys have been doing. And maybe we can get over either to Andrews or up to Walter Reed and see our medics at some point. Our next question comes from Nikki. And Nikki asks, can you tell us about the grooming standards? So yeah, we as an Air Force, along with some of our mostly in shade the field, because it really depends where you station and what resources and what capabilities that you have. I know in some places the barbershops are closed, and so we don't have barbers working. And absent of you or your wife or your son or daughter giving you a bowl cut in the kitchen or in the garage, we've again allowed some commanders to relax some of the grooming standards. Again, we ask you to balance this relaxation of grooming standards across the force with the level of professionalism that we expect from all of us as airmen. Now, again, we understand these are tough times, and we don't expect you to be crisp and clean cut like you normally would on a daily basis when you come to work. But we still have to represent this cloth of the nation on a daily basis, and so certainly when you're in uniform, just do the best that you can. And like I said, we trust commanders out in the field to make the right decision for their airmen based on the circumstances in the area which they reside.
So Dawn gave me my first haircut last week. I'm not sure who was more nervous. It actually turned out okay.
It looks good. You look good.
Yeah. I actually sent a picture of one of the Three Stooges, the guy with the bowl cut, to my daughters and said, "Hey, Mom, cut my hair. What do you think?" Okay, here we got one from Wendell, and I may mess up this last name. Wendell, if I goof this up, I apologize. Mickey Loeb. And actually, the same question came in from Dennis Fusilier, and both of it's about use or lose leave. And a great question. Is it possible to raise the use lose leave program? And the answer is yes, we're looking at that. So again, same dialogue we just had with the Secretary of Defense and so many the other senior leadership. This was also brought up by Chief Colon Lopez, brought that up to the Secretary of Defense and said, hey, we got a number of folks who just can't take leave. Can we authorize them to carry that over a larger number than the usual 60? The SecDef assigned that to the OSD team to resolve that, come back to him with some recommendations. I think we're going to get probably a decision on that probably within the next week to 2 weeks. And so, again, sorry I don't have an answer for you right now, but I can tell you that the chiefs are looking at it for us. Thanks.
All right, next question. Megan Brown asks, how can those who recently got out be able to help support and combat COVID within the Air Force? And can we come back in? So right now, at least to my knowledge, and I'll make sure that I confirm with our A1 team, we don't have a provision necessarily for bringing people back into the Air Force to help out with this. But what I would say is I'm almost certain that you still have friends and or family that are still serving. You may be friends with, either active duty, guard, reserve, airmen, or their family members, and just do as much as you can to support them. And sometimes that's just a phone call, a Zoom meeting, an email, or a note of support to let them know you understand what they're going through, like all the rest of us. And I think that support goes a long way. One of the things that I think really helps us during this tough time is connectivity, being connected with the people that we love and care about, and having someone that kind of understands what you're going through. And I tell you what, Megan, if we start recalling folks back into the Air Force, you'll be first on the list. We'll give you a call. I'll personally give you a phone call if we need you to come back in.
Okay, Chief. I got one here from Jeff, who said, what does the new normal look like for you personally and professionally? And this is, Chief, for both of us, new normal. It's interesting to see as we go through this, what does the backside actually look like? We have some that are a bit ahead of us in their response to the virus, both from a timing standpoint more than anything. And so, seeing what that recovery looks like in terms of when we have confidence as a nation, and certainly as an Air Force, that we're on the backside of this, because it'll be more than just the number of cases going down. There will be a lot of data that we're going to look at to ensure that we feel like we've got this thing licked and we're on the backside. And then the question becomes: Do we actually arrive at a point equal to where we started, or do we arrive at a different place? I personally believe we'll arrive at a slightly different place. There's going to be longer term economic impacts that are associated with this. There will be certainly longer term health care issues associated with this. The virus is a virus. Until we have a vaccine, it has the option of coming back. And so to me, I think we get on the backside of the curve, have confidence that we have weathered the worst, get back into the business of the national business and the military business that we do globally. And then I think we're going to probably make some long-term adjustments as an Air Force as we look at this in the future. And so this is where our culture, I think, is very helpful to us, because we tend to be a force of innovators, right? And every airman's an innovator, and we go to a base, and the first thing we start looking at is, okay, how do we improve that? That culture is going to play really well, I think, for us going forward, because we're going to find creative solutions to some really complex challenges. For the Chief and I, the most important thing that we do is try to create the environment where those great ideas get a hearing. And we're doing that through a number of ways, perhaps most importantly, communicating that we have absolute and complete trust and confidence in our command teams, and to enable them to create the environment where that creativity comes forward. Thanks, Jeff.
So yeah, I say from the big Air Force standpoint, this kind of new normal has allowed exactly what you talked about, Chief. It's allowed, we've tried, I think, during our entire tenure to create an environment where commanders and command teams can have the right levels of authority, make decisions, allow their airmen to innovate. And this pandemic has kind of been maybe a breeding ground for that level of innovation and command teams to showcase their leadership. And like I said, it's just been a joy for me to watch. For me personally, my new normal is, so I typically spend a great majority of each year on the road, visiting airmen and getting after the things that the chief and the secretary asked me to get after for them. And so I've been grounded and no longer traveling, but it hasn't affected my ability to affect the people and the programs. Doing a lot of virtual work, just like we're doing here today. I'm in the buildings a couple of 2-3 days a week to make sure that I can lay eyes on my wingmen and our team. My team and I do a weekly Zoom sync to make sure that we stay on the same page, and then I sync with a couple of different other leadership teams across the Air Force. So it may be a little bit inconvenient at times to not be able to move like we normally have, but I think if we embrace and use the technology that's available to us, we can work through this challenge, and at some point, hopefully within the near future, we'll be ops normal and right back to getting after things the way that we have done in the past prior to this happening. I like what you said though, boss, that I don't think any of our missions are in jeopardy. So our ability as part of the joint team to defend this nation and do the things that the president and the SecDef ask us to do, no question in my mind that we can still execute all the missions that's required of us.
Thanks, Chief. And one of the things Chief and I have been talking about lately is, in a responsible way, the Chief and I are going to start doing some traveling. We got to be responsible about it because there's no zero risk option. When we travel, that we have a small team that travels with us, and we have to make sure that we're doing this in a smart, effective way. So you can expect the Chief and I to start getting out to see our airmen, especially who are engaged in combating this virus. So we talked about mobility, we talked about medics, out to see our nuclear warriors, to see those who are guarding the nation in cyber, some of our headquarters that are working blue silver teams. So you can expect us to get out and about, and then we'll report back to you, perhaps through this forum on Facebook, what it is that we're seeing. I got a question here from Phil Dismukes. Phil happens to be one of my classmates from the academy. Phil, so thanks. If you were Phil Smith, you could have hid, but you're like Goldfein, you're not going to hide with a name like Dismukes. So he had a question about COVID. He says, how COVID-19 may impact recruiting and for those called to serve. 9/11 saw a dramatic increase in patriotic response to the armed forces. Is there a fortified and accessible program now for young Americans to find a path to a career in the military and, of course, the United States Air Force? Yeah, thanks. We, after 9/11, and I think we will see that again across the nation, patriotism will be on the rise, especially as they see our incredible Air National Guardsmen and our reservists, as they race to the sound of the guns and take care of the nation. I think as they're exposed to those of us in uniform, patriotism will be on the rise, and we will see more folks who will want to come join us. And for anybody who might be listening who is contemplating a career in the military, and that's just the United States Air Force, but obviously the Chief and I are a little bit biased. If you want to work with the most incredible people on the planet, to your left and to your right, if you want to do really important, hard work, do things that are far more important than any individual, that are much bigger than ourselves, and really make a difference in your life, then come join us. We have a place for you, for every one of you. And so, Phil, I do hope that we'll see increased recruiting as we go forward. And even though Chief Raymond's not here, I'll speak on behalf of my battle buddy and teammate, Chief of Space Operations. He's also hiring. And so we're looking for young men and women who are interested in serving and owning the ultimate high ground of air and space. We got a place for you. Come join us.
All right, before we get to our next question, Mark Hogan asked us to shout out all first responders, especially the defenders of our great Air Force. So hua hua to all of our defenders and, of course, all of our first responders. We had a question from Mike Connolly, any insights into boards for airmen and NCO in lieu of WAPS testing. Right now, as we try to work through this COVID-19 and making sure that all of our airmen and families are taken care of, things that some of the revisions that we're working on, both in the enlisted and the officer evaluation systems, they haven't dropped off our radar. But I'll be honest with you, some of that stuff has been pushed down a little bit on the priority list. So we'll continue working. We don't have any definitive answers right now. We have a pretty good team that's been working on both sides on evaluations. And so we'll try to stay on the timeline to revise both of those systems. But right now, all of our A1 folks and most of our folks at AFPC are pretty heavily focused on making sure we can get through this pandemic. Joseph Lungerman, as we start coming out of this crisis, many of our peers are worried we'll be asked to surge and get back to work at once. How do we avoid a resurgence of COVID-19? I think this is a really good question. And I trust that our medics and our command teams will be cautious, that we won't just drop everything at once and say, okay, now everybody go back to work. I really like that COVID-19 has forced us to build some good habits that we probably should have had anyway, like the constant washing of our hands and being cautious when we're in public places. And so hopefully many of those habits continue. Again, I know our medics and our public health professionals will give us the right guidance that we need to be able to ease back into work and continue being efficient and effective.
Okay, I got one that just came in from Joel Jeffrey and Alexander Clark. Both asked, what's our perspective on continuing to ship people to BMT, base military training, and when there are different DoD and branch directives wanting to minimize exposure? Yeah, thanks, Joel and Alexander. We went through a pretty rigorous analysis with Lieutenant General Webb, the commander, and Major General Andrea Tullis, who is the 2nd Air Force commander responsible for BMT. And the question we asked was, first, do we consider this mission essential? And number 2, if we stop, do we understand or have the criteria in place for which we can then restart? So when we did the initial analysis, what we got a sense of was that, if we stopped until like the middle of May, which was one of the first offerings on the table across all of the services, it would have cost us about 6,000 airmen and taken us about 9 months to recover. And so the question we asked was, all right, then should we look at continuing BMT as mission essential work and pipeline training, but do it in a different way? And so General Webb and General Tullis came back to us with a recommendation that we approved when the chief and I looked at, all right, so folks will come in from all over. They'll go into 14 days of observation with very restricted movement. The science tells us that if you are clean for 14 days and then test negative, that you do not have the virus. So now, despite where people come from, they're isolated, they're washed for 14 days. Once they're determined they're clean, then that class moves into BMT and begins. And we're doing about 50% of the usual numbers as we keep that going. So far, it works. We've had 5 in about 6,000 total numbers that we put through in the time frame, because we're bringing folks in every week. Of 6,000 that we brought in, we've had 5 test positive, and those have been symptomatic but have recovered, and then that we put them back into training once we've been through another 14-day period. So far, the procedures we have in place seem to be working really well. So we're going to continue on this pace until we are on the backside and we can start ramping up the numbers again. Thanks.
All right, I think we got just a few minutes left, so I wanted to address, we had a question from Joe Del Toro, essentially about training and NCO Academy. Will they be able to continue? Will they receive credit? I think right when this all hit, most of our NCO academies were able to graduate, except Shepherd, I believe, who was only about 7 days in. And so what we're going to do with those folks who specifically were at Shepherd is we were already testing a new and improved, much better than the previous course 14, course 15 that we had, new and improved distance learning program for NCO Academy. So we're going to allow those students who were at Shepherd to enroll in that distance learning program. And if they complete it, and this is voluntary, if they complete it, they'll receive credit for NCOA. And if they have other priorities and other things happening right now, which is totally understandable, then we'll get them rescheduled for NCO Academy at a later date. For the individuals who were in senior NCO Academy, I know same thing, that just kind of started, and when we sent everyone home, we don't have a distance learning that's quite ready for them yet. But what we do have is enough capacity and enough space to be able to reschedule all of those students who were currently in senior NCO Academy. We'll be able to get you back in this fiscal year. So you'll be able to continue your professional development efforts. And as always, I encourage you, while you're not in PME, lots of great books. The boss has a fantastic reading list. I just put out a list of books that I recommend, along with some podcasts. There's just so many resources. I'd like to give a shout out to Air Force Quarantine University that I think was started out at Edwards by Chief Ian Eishen. So, continue utilizing all of the resources that are available for your professional development needs.
Okay, Chief, looks like we're coming close to a wrap. I got one last quick question here. Jennifer Sutton asked, can I speak to changes at the Air Force Academy? Her daughter has accepted her appointment June 2020. So first of all, congratulations to your daughter. Really well done. So we just came back from a trip to the Academy, and if you've been following the Academy, you know that we're going to graduate the class of 2020 on the 18th of April. And that there's been a significant process we went through to take a look at, what we needed to do to get that class completed. What we don't know, Jennifer, is at what point we're on the backside of this virus and we can accept cadets coming in. I can tell you that your daughter will come into the Academy. I can't guarantee it would be on the normal timeline. Likelihood is we'll bring her in later, and then we're going to adjust. The Academy is looking at this right now. What kind of adjustments that we have to make to ensure that we get on the backside of this and continue on. So just some closing comments, then Chief, maybe give you the final comments. So, one shout out to our airmen that are in the mission support groups out there, the support airmen, they're out there delivering meals, taking care of personnel, and just keeping, taking care of us so we can take care of the mission. For each of you that are on Facebook, and for your family, your friends, your fellow airmen, we need each of you. We're asking a lot of you and your families, and what we do matters. And when the nation is in crisis, it leans on the institutions that it trusts, and it trusts its United States military. And that's not just because of what you and I do every day. It's also because of those that have gone before and whose shoulders we stand on. And now is when we need to step up and support the nation during this time of crisis. There's a lot of uncertainty, but here's the good news. We have exceptional commanders and chiefs out there and volunteer lead spouses who have absolutely strapped on this challenge and are leading with compassion, with integrity, with creativity. And I know for me, I just couldn't be prouder to serve with each and every one of them and each and every one of you. So thanks, Chief.
Yeah, I just want to reiterate how I started and say thanks to all of our folks who are standing watch. Thanks to our medics. Thanks to the folks continuing the training pipeline. We really appreciate your dedication and your selflessness. We also appreciate the command teams. It has been just a pleasure to watch the wing commanders, command chiefs, like I said, leaders at all levels that are finding innovative ways to continue to get the mission done, and most importantly, to stay connected. And I certainly be remiss if I didn't talk about, my other battle buddy, Chief Manny Pinheiro, the First Sergeant Special Duty Manager for the Air Force, is not here. But I'd certainly like to give a shout out to all of our first sergeants who are out making sure that our airmen and families are taken care of. So General Goldfein and I, along with Secretary Barrett, we appreciate your leadership. We know these are some challenging times, but we also know that you guys are up to the challenge. And so thank you, and we'll see you on the next engagement here on Facebook. Make sure you use the tools that are available to you to stay connected. That's one of the most important things at this point. So thank you, guys.